Can we prevent brain hemorrhage? The brain is an amazing organ that controls the central nervous system. Involuntary actions such as heartbeat and digestion are governed by the brain without us realizing it. Damage to this amazing organ can affect our whole body. The most important of these damages is brain hemorrhage. So what is a brain hemorrhage? Cerebral hemorrhage is bleeding that occurs in the brain tissue and surface inside the skull. A brain hemorrhage occurs when blood leaks out of the vessels inside the skull. This can cause very serious disabilities and even death. So what causes brain hemorrhage? No matter how healthy you live, you may be at risk if you have congenital vascular disorders. One of the most important causes is hypertension. Trauma to the head can also cause a brain hemorrhage. Blood thinners and the use of certain drugs can also cause brain bleeding. If you found my video useful, I would be happy if you support me by liking, subscribing and commenting. What are the symptoms of brain hemorrhage? Symptoms may vary depending on the person. Symptoms depend on the site of the brain hemorrhage, its severity, and the amount of tissue affected. Symptoms can appear suddenly or insidiously over time. It is therefore very important to pay attention to the symptoms. These symptoms include clouding of consciousness, nausea and vomiting, dizziness and lightheadedness, severe headache, disorders of brain function, numbness and tingling in the legs, difficulty moving and numbness in the arms, vision problems, difficulty swallowing, unilateral facial paralysis, numbness and weakness on one side of the body, impaired balance and coordination. Severe headache is important. Patients often describe it as the most severe headache I have ever had in my life. If you are experiencing one or more of these symptoms, it may be vital to consult your doctor. Imaging techniques such as computed tomography, CT, and magnetic resonance imaging, MRI, are used to diagnose brain bleeding. These imaging techniques provide extensive and comprehensive information about the location and characteristics of the bleed. Since it is very important to intervene quickly in brain hemorrhages, the CT method is usually used, which gives fast results. So how is the treatment of brain hemorrhage? Your doctor creates a customized treatment plan for you. Urgent intervention is required to prevent permanent damage to brain tissue. Surgical methods can be used in the treatment as well as drug therapy. Recovery after a brain hemorrhage. The recovery process after a brain hemorrhage can be different for each patient. Appropriate treatment methods should be determined according to this process. Therefore, recovery from brain hemorrhage is a complex event that requires the joint efforts of many specialties and health professionals. The location and severity of the bleeding, timely and correct intervention, physical therapy, and rehabilitation are the most important factors affecting the recovery process after brain hemorrhage. Better results are obtained with early treatment of brain hemorrhage. Is it possible to prevent brain hemorrhage naturally? We can minimize the risk of brain hemorrhage by paying attention to healthy living rules. Consume foods that support brain development and health. Since brain development starts in the womb, it is important for expectant mothers to eat a regular diet with a high folic acid content. Foods such as beans, peas, spinach, turnips, lemons and oranges should be consumed for folic acid support, which should also be considered in adults against the risk of Alzheimer's and dementia. Bananas and legumes. It is important to consume bananas, legumes, meat, fish, skim milk, yogurt and green leafy vegetables containing vitamin B. Vitamin B plays an important role in the development of memory and intelligence. At the same time, vitamin B helps to produce new cells and maintain the structure of existing cells. Fish rich in omega-3 should be consumed at regular intervals in order for brain functions to work more smoothly, to strengthen memory and to think faster. Cashew and peanuts. walnuts, hazelnuts, cashews, peanuts, sunflower seeds, sesame seeds, flax seeds rich in vitamin E should be consumed to slow down the decline in the brain that occurs with aging. Grapes and strawberries. While grapes, which stimulate the secretion of dopamine, increase problem-solving ability, fruits such as strawberries, blueberries and vegetables such as tomatoes and carrots, which contain high levels of antioxidants, protect the brain by improving memory. To learn more about the Reboot Your Brain, go ahead and tap on this video on the screen now. Thank you so much for watching my video today, and as always I wish you great health, wealth and happiness. Stay healthy, see you again.